Merritt Bates Thomas is back with us from the Green River District Health Department to give us an update on the virus in our area. Good morning.
Good morning, Angie.
How are you?
I'm doing well. How are you?
I'm doing well too, and grateful for it. And I know this is such an interesting time for you and your work.
It's a very different experience. It's a far cry from the work I do on a daily basis in a normal atmosphere.
Well, let's talk about the coronavirus and what you're seeing, because we get the numbers, and after a while you just sort of get numb to the numbers. Well, what do they mean, and where are we right now?
You can, and it's easy to get numb to it. That's actually the perfect word, I think, or to begin to tune it out. And we've carried along with a pretty steady stream of numbers over the past month or so, about 6 weeks. And last Sunday, we went over the 300 mark in our 7-county Green River District at 304. And now today we find ourselves at 404 confirmed cases. So over the last week, it really picked up quite a bit with new confirmed cases popping in. And yesterday we reported out no new confirmed cases. So mixed in there, we had that interesting anomaly, if you will, of no new confirmed cases, and back today with 19. So it really tells us a story. COVID-19 is still present in our tri-state area, and we can't get numb to it.
And that is just so hard because we're overwhelmed by not just our local numbers, but of course the national ones and global ones are breathtaking in a very negative way. But when you see these numbers, what do they really represent based on the amount of testing we can do?
Well, that's a very good question, and I'm not actually sure. We just really have to put that in perspective. Increasing our testing capacity is so important. And then the key thing is many people asking the question, should I be tested? And there are varying opinions on that. The key piece is if you're symptomatic, you definitely want to seek out medical guidance and get tested if you're falling into that cluster of symptoms that lead you to think you could possibly have COVID-19. So the key thing, I think, is just to continue heeding that guidance we've been giving. You all have public service announcements running on WEHT. Wash your hands. One of the newest pieces of guidance is to wear a mask, and guiding people to do that now as we begin to open up in stages or phases, depending on which state you're in, and we get back to being around others, where for so long we've been staying safe at home. And maintaining, as we do get out, wearing our mask, maintaining that physical social distancing of being at least 6 feet apart.
Well, as businesses are reopening, and some of them are really customer facing, what should we need to be most aware about? Certainly the mask, certainly washing our hands. What's key right now as we carefully try to go back to business?
Well, being respectful of others and realizing this is a new experience and we're all in this together. So really practicing a lot of patience and modeling what it is we expect. We're all hearing this guidance, and if we want others to be 6 feet apart from us, let's give them that same courtesy, be 6 feet apart from them. Our essential workers who've been out there this entire time serving us in a variety of capacities, really looking out for them and respecting that. They have been in there day in, day out, getting the job done. And so as we get out now more frequently, extending those courtesies to them and being respectful of the situation they're in and day out as they work.
We've just got a few seconds, but I want to ask you, are you anxious about seeing those numbers rise? Are you expecting them to now that we're reopening?
COVID-19 is still present, and if we're not cautious and careful and we go back to business as usual, we will see those numbers rise. There can be some promise to practicing these good measures and seeing how good we can be and what that can mean in terms of keeping that curve flat, if you will. Because if you look around at numbers throughout the tri-state, we have done a reasonably good job. While we've seen increases, they could have been much more significant had we not taken the measures that we did take.
That is a good reminder. That is a very good reminder. Mary, thank you and your team for all you have done and will continue to do.
Thank you, Angie. Good to talk with you.
You take care. We'll be back with more Local Lifestyles after this message. Please stay with us.